I was almost going to have my colostomy, and the colostomy had not served me yet. And there's a call from the hospital and saying that patient is in heart attack, and I will have to rush to the hospital. By the time I was in hospital, just a few minutes, the patient going into cardiac arrest.
Just suddenly, just a blackout from there. I did not know what happened.
I'm Dr. Sian Kong, resident consultant interventional cardiologist in Normah Medical Specialist Centre. Other than being a cardiologist in this hospital, I'm also appointed as the chairman for Infectious Control Committee, overseeing the infectious control in this hospital, microbiology work, and usage of antibiotics. Besides that, I am also being appointed as the president for the Medical and Dental Executive Committee, overseeing the hospital policies and healthcare issues. Actually, I didn't know that I would become a cardiologist when I was a kid. And I have interest in invention and innovation. And one of the very important factor that I took out interventional cardiologist because it has very great impact to my patient. So we are able to perform complex coronary intervention. For example, chronic total occlusion, totally occluded artery, and we're able to re-establish flow in that artery using coronary interventional techniques. And the other thing that sets us apart is we have cardiac surgery. We have been performing that for the last 35 years since Normah was established. And it was the only hospital able to do so back in 35 years ago, and that really set us apart. We measure our performance by patient safety and patient's outcome. Anyone who comes in here to do a procedure or surgery would like to answer this two questions. Am I safe to undergo a procedure in this hospital? Am I safe? If I go through that procedure, do I get good outcome? Every one of us will answer that question, be you a patient or you are a doctor. So we keep this on our toes every day. We have policies, we have protocol, we have guidelines set up to keep these two, safety and good outcome to the patient. And we measure our performance by JCI, which is just one of the audit tests. We took another test, which is MSQH, and we passed them. It's because each one of us, medical or non-medical staff, they are patients advocate. What do I say about that? It's because every one of us thinks of the patient's right first. Right for information. Is it correct to do this test? Is it necessary? Is it indicated? We don't want to waste the resources. We don't want to waste the patient's money. We don't want a patient to come into a hospital thinking that they will spend a lot of money in this hospital. This is a not-to-profit hospital. Meaning to say everything that we earn is for sustainability and the patient's welfare. I was almost going to have my colostomy, and the colostomy had not served me yet. And there's a call from the hospital and saying that patient is in heart attack, and I will have to rush to the hospital. By the time I was in hospital, just a few minutes, the patient going into cardiac arrest.
Luckily, I arrived at the emergency. It's around I think 8:30 or 8:40 a.m. in the morning. But at that time, I thought it was not something really serious. I know something to do with heart. At that time, I had some medicine. Give me some medicine. And from there, what happened? After taking the medicine, I feel a bit relief. The pain slowly just disappeared, slowly. I even managed to contact my wife just to inform that I've got a chest pain. So anything, please can contact my friend here in Kuching because my wife in KL. And just suddenly, just a blackout from there. I did not know what happened. Only, it's just like I woke up from sleep and I saw my wife and I saw some friends.
And what makes it very wonderful is I have a very highly skilled, trained personnel that assist me. I'm not the hero. they are the heroes. They assist me, they cardiac arrest, they can manage to do a very good CPR. All of us are ACLS trained and we renew our certification every 2 years. Dr. Alvin Tan, our anesthesiologist, managed to intubate the patient and we revive the patient.
Now I've got 3 stents. How I'm feeling? I'm feeling very well. Thank God. Alhamdulillah.
I think in the future, healthcare should be more affordable so that it's accessible to everyone. That's number one. Number two, we should go into education. We should, like I said, nursing training, postgraduate training, even getting Form 5 students attached with us, see how we work. And we encourage research. And we have memorandum of understanding with UNIMAS. And we are ready to teach the medical student as well. We also help the neighboring country, especially Indonesia, to build their nursing care. They have sent their nursing student to us to attach with us, and we really we love to teach. We go beyond just medical services. We extend our service into education.